Hey everybody, welcome back to another episode of Ask Kati Anything. I'm your host, licensed marriage and family therapist, Kati Morton. I am so glad that you're here. In today's episode, we're diving into a bunch of thoughtful questions from our community, everything from breaking the habit of nail biting and skin picking to navigating comparison, perfectionism, and imposter syndrome. We'll also talk about menopause, how it can affect mood, depression, and even how ADHD medications work. Plus, what happens when your diagnosis suddenly changes and you're left wondering who to believe. And finally, we'll explore what it's like to be diagnosed with ADHD later in life after years of being told it was something else entirely. So whether you're here to better understand your mental health or just love learning more about how brains and emotions work, this episode is full of real questions, honest conversations, and hopefully some practical takeaways you can use today. Without further ado, let's jump into question number 1. This question says, Kati, random question, how do I stop biting my nails? I have this compulsion to pick at the skin around my nails and the edges of my nails. I also do the same thing to any scratches, bites, or skin imperfections. I feel the need to, quote unquote, fix them. I usually keep going until they bleed. When they bleed is when I can finally stop. I've tried getting my nails professionally done so I don't touch them. I've also tried that nail treatment that's supposed to make your nails taste disgusting. I've heard of that, but nothing works. It's so embarrassing. My skin and nails look so gross. What do I do? This is a great question, and random thing, I used to chew my nails, so did my mom, and one of my roommates in college, Veronica, she used to chew her nails, same as you, she'd pick at the skin. And so I have not only a lot of personal experience, but also I did some research to figure out where this could be coming from. There's a lot of different options and what we can do. Now, when we are picking the skin in particular, when we pick our skin in general, it's called excoriation. And I have a video about it. You can look it up. Excoriation, Kati Morton on YouTube, it'll come up. But essentially that's the compulsion to pick at our skin. It's also closely connected, not to be confused with trichotillomania, which is when you pull at your hair, like eyelashes, eyebrows, and your hair. Both of those things, excoriation and trichotillomania, are often fueled by anxiety. And I would argue that biting the nails falls into that, but we'll talk about that specifically. That the anxiety we feel internally kind of buzzes around and we have to do something, take some action to help us feel better. Hence, skin picking, hair pulling. It can be even those of us who struggle to not pick at like spots on our skin. All of that is driven by anxiety. And I can even speak personally that when I used to chew my nails, it's definitely an anxiety thing for me. Like as I get more stressed out, more overwhelmed, the worry starts to build. That's when it gets worse. So my first question for you is, or I guess homework, is to notice when the biting of your nails gets worse. And if we can tell if that's, connected to us feeling more anxious, is that like stress at work or school? Like, is there something going on, stress in our relationships? Do we find that it gets worse in certain scenarios or not? We're just doing our detective work, right? But that's my first hypothesis, that it comes from anxiety. And if that is the case, then finding a therapist who treats anxiety, this could be someone who does cognitive behavioral therapy, otherwise known as CBT, could even just be traditional talk therapy, or we could see a psychiatrist and get on an SSRI or SNRI, otherwise known as an antidepressant. I know it says antidepressant, but those also can be beneficial for those of us with anxiety. So they might put you on something like, Lexapro, let's say. So that's kind of, if we think it's triggered or caused by our anxiety, that's how we can go about treating it. Now, because yours is specific to biting your nails and you said that you feel this compulsion, I'm wondering if yours is tied to OCD. Now, OCD, for those you don't know, I do still put it under kind of the umbrella of anxiety, but it stands for obsessive compulsive disorder. And the way that OCD works is that we have this obsession. Usually the most common in OCD is checking. So like I need to check that I turn the stove off. I need to check it a certain amount of times. And I can't move on to the next thing or relax until I do that. But in your case, it might be like, I can't stop picking the skin until it looks a certain way or feels a certain way, or I start to bleed. And so you have to do this thing, you have to do that compulsion, right? Because we have the obsession about it, we have the compulsion, which is the action, and then we have a little bit of a, like the anxiety of it, or the build of that anxiety kind of goes down and then it starts again. And that's kind of that OCD cycle. And so I don't know if that resonates with you, but the fact that you said you have this compulsion and you can only stop when you bleed makes me think that it could be linked to OCD. Again, still under the umbrella of anxiety, but treatment is a little bit different. So if we think that it is obsessive compulsive disorder, chances are you will see this playing out in other ways as well. Like I said, like the checking number of times, having to do things a certain number of times is very common as well. You can have cleanliness compulsions. I know a lot of people think that OCD means that we're clean. That's not the case, but for some people it is. Again, the checking and stuff is the most common. But with that in mind, when it comes to OCD, the way that we treat it is a little bit different than, generalized anxiety disorder. We have you put off the compulsion. So let's say you're sitting there and you can feel a little bit of skin on your finger and you're like, oh, I want to pick at it. I want to pick at it so bad. And you feel yourself like getting kind of overwhelmed by it or anxious or stressed or whatever you want to call it. You feel your energy moving up, ramping up. In order to stop us from getting in the cycle, we have to not do the compulsion. We have to put it off as long as we can, because the truth about it is that anxiety build or that stress build that we feel, it peaks and it goes down without us having to do the thing we don't want to keep doing. And so I encourage you, if what I said before, you're like, it doesn't quite feel right. And I talk about OCD and you're like, yes, yes, yes. I want you to start trying to put it off. When you want to bite your nails, when you want to pick around the skin, can we put it off? 5 minutes, 10 minutes, maybe it's just 1 minute. There's no judgment here. We're just trying to put it off for as long as we can. And trust me when I tell you that it will peak and go back down. But that will tell us that this is OCD related. And the longer and the more frequently we can put it off, the quicker it will go away. I know it's kind of wild that that's how it works. But essentially what we're doing is telling our brain, or teaching our brain rather, that nothing bad is going to happen if we don't do that thing. It's like in the case of checking, I had a patient forever who had to check that she'd locked her door. I think it was 11 times. It was always an odd number. But she would have to go back and do it and do it and do it and do it. And I would have her just sit and not check and calm herself down and know that we'd be okay. And it slowly got to the point where she would just lock the door and she would tell herself, I've locked the door, and then she'd walk away and she didn't have to do it anymore. It took practice and it took time, but it can and will get better. And that's why I don't believe that you made me giggle with the stuff you put on your nails to make them taste disgusting. I told you my mom used to chew her nails when she was a kid. They tried that with her and it didn't work either. And so even though it's a deterrent, technically, it doesn't really help us, quote unquote, fix the problem, right? If it's driven by anxiety or OCD, having it taste disgusting is not going to make it any better, right? It's not going to make it harder for us or make us not want to do it. It just means that it won't work as well. It might be but we'll keep going because that's not why we're doing it anyway. So I never recommend those things because in my experience, that's never really the cause. That's never really the reason. And having your nails taste disgusting, if you feel the compulsion to do it, or if your anxiety is so high, you don't know what else to do with that energy, you're going to do it anyway, or you're going to find another way to get that energy out. I also, as a last little bit of ideas and how to help you, I would like you to try to do, when you feel this urge, maybe try doing a full body shake or dunking your face in cold water. I know I mention those things all the time, but it's because they work. If we feel our anxiety building, or even that obsession, and the urge to do the compulsions building, and we feel really overwhelmed and we really want to do the thing that we're trying to stop doing, maybe giving that outlet, giving our body a release for all that queued up energy could be the thing that we need. It's that action, right? It might just help us feel better. And we can finally stop. Because I'll speak personally, when I used to chew my nails a lot, it was definitely stress and anxiety driven. And going to therapy is the thing that made it stop. I don't really bite my nails anymore. I don't feel the compulsion to do it. Yeah. And really, I was thinking when I read your question, I'm like, what was the thing that helped me? Therapy. I wish it was a better answer. I'm like, I tried this one trick. It was actually therapy. So I had to take that edge off because that was why it was happening. That's why I felt that urge. So anyway, I hope some of that helps. Do some of your own homework and figure out what's causing it for you. But I hope that one of those tips and tools is beneficial. Moving on to question number 2, it says, Hi, Katie. I hope you're doing well. I am. I hope you're doing well. I've recently realized that I keep comparing myself to other people. One of my favorite quotes is, comparison is the thief of joy. I did it before with friends when I felt they were smarter and I didn't deserve them. And I'm doing it now with a hobby of mine, editing, and my new editor friends. I don't know how to stop. I try to turn it into inspiration, but it doesn't always work. And I wonder, why do I even try when they are already so good at it? I've been receiving support over my editing channel, but most of the time it's hard to believe or actually soak in the compliments. I wish my brain didn't do that. I want to be able to accept them and believe them. And it feels worse because they've been so supportive. At times I'm terrified because I feel like they might find out that I'm a fraud somehow. Like if my edits are not perfect and every project needs to be better than the last one. In any case, I'm never satisfied or relieved. I guess that is perfectionism and imposter syndrome for me. Anywho, sorry if you've already covered this topic before, and thank you so much for doing what you do. Of course, this could be imposter syndrome or perfectionism, which I think both of those go down. It comes down to our confidence. Your urge to compare yourself to other people doesn't just start with editing. That's the perfectionism where you're like, oh, it needs to be perfect. And what if they find out I'm a fraud? That's kind of imposter syndrome ish and perfectionism, but that's not the only place it's shown up. It's also shown up with your friends where you thought they were smarter than you and you didn't deserve them. And that to me was a huge indicator, like a little red flag went up. And that tells me that deep down inside of you, you don't think you're good enough. You don't think you are enough, maybe. I don't know what rings more true to you. You'd have to kind of be curious, not judgmental, about how you talk to yourself and what you think about yourself as a person, as a friend, as a human on this earth, as someone sharing the planet with me. How do you think about yourself? And I know I talk a lot about confidence and how that's the root of a lot of things like anxiety. And in this case, this kind of perfectionism, imposter syndrome, comparison. But that's because confidence is so vitally important. And we don't really talk about it enough in a real way. We often feel like, oh, we should be confident, but nobody explains why, or why it's so hard for us, or that confidence is not cocky. It doesn't mean that we don't care about other people, or that we're vain, or we're a narcissist. Unfortunately, I think we throw around a lot of terms these days that are mental health terms, and we talk about them in the wrong kind of way. I feel like everybody thinks someone they've dated is a narcissist. And while that's very possible, that often people feel like, oh, if I'm too confident, people are going to think I'm that. And that's not the case. Confidence is the foundation from which everything in our life can grow and thrive. And what I mean by that is that we need to have faith in ourselves. We need to feel that we can do it. There was this, I think it's because Taylor Swift's new album came out, but there was a little clip and she's reading an old diary of hers. I don't know if it's from Miss Americana, the documentary, but people have been clipping a bunch of things together, but she's getting ready to go on stage and she's having a hard time. She's like, I don't really feel up to it, which I get sometimes not even to call myself a performer or put myself in any of the same league as Taylor Swift, but as someone who speaks and, creates videos for you guys and does live streams. And I do a lot of things where I have to be engaged for you. I have to get it up, get excited, get energized, make it fun, make it interesting. I really felt for her because she was saying that she just didn't feel like it that day, but she was like, but they all showed up and I need to get excited with them. And, she's reading this little bit of her diary and she says, I just don't feel like I can do it. What if I can't? And she said, no, I've been wanting this forever. And I know that I can. Deep down inside of me, I know I can do it. And so she kind of argues with herself. I don't know if I can. Yes, I can. I've been wanting this. I can do it. And we have to do that for ourselves. I feel like that little clip or blip from Taylor Swift's journal or diary from when she was 12 years old or whatever, or 15, I have no idea. It shows what we should be doing with ourselves. If you're having doubts about who you are, how smart you are, how capable you are, I want you to argue back. Like you're your own big sister or big brother, or I don't know, somebody, a best friend that cares about you. Argue back against those nasty negative thoughts you have, that you're not smart enough, that you're not that good of an editor, that you're somehow a fraud, or you don't really know what you're doing. Instead, I really want you to challenge those thoughts. I want you to tell yourself, maybe it's checking your facts, because obviously we can't do toxic positivity, oh, I think I'm so stupid. No, I'm the best ever. That's not what I'm talking about. I'm just talking about being kind to yourself. Like imagine that you're your own best friend, because you should be. And how would you talk to her about this? Could you tell her that I know you're trying your best and it's really cool you've learned this new skill. You're editing so much better today than yesterday. If we find ourselves comparing, can we try to pull it back in and say, I actually am pretty smart. I did okay in school. I got mostly A's and some B's. That's pretty smart. In a way, by doing that, we're not only checking our facts, right? Like I got these grades, or I'm good at this. I'm better at editing today than yesterday, but we're also challenging that negative self-talk or that negative thought, because that's really what's happening here, is that you're just talking shit to yourself. You're eroding your confidence, if you have any left, in who you are and what you're capable of. And that's why you feel bad. And that's why you have imposter syndrome. That's why you worry, why do my friends even like me? That's why you have all the thoughts that you have. And so in a long-winded, roundabout way, we have to build your confidence. And the fact that you're doing this editing is really cool, because one way to actually build confidence is called building mastery. It's a DBT skill. And it's when we learn how to do something and we just get better at it. Does it mean we're the best? No. Did I say you have to be better than everybody else? No. Did I say that your friends, outside people, have to recognize that you're doing it well? No. All you have to do is learn a new skill, like you have, editing, and get better at it. So the only thing I want you to compare is what you edited right now from what you edited yesterday or 2 hours ago. Do we learn a little bit more on timing? Do we learn a different way to make the graphics swipe in? I don't know. I'm not an editor, so I'm making things up. But think about it. And let's start to try to focus our energy on that. And if you find the negative thoughts try to pull you away, do what Taylor Swift did. Journal against it. Argue back. Check those facts. Use those facts as you need to, kind of like in a quote unquote court of law in your journal, to prove that you are good enough, that people want to be around you, and that you're actually good at the editing that you've been learning to do. And you have a whole channel. How cool. Yeah, I hope that helps a little bit. I know it's like not the easiest answer, but trust me when I tell you that that's the real way for you to start feeling better about who you are and stop comparing yourself to others so much. Moving on to question number 3, says, hello, howdy do. I'm curious about your thoughts about menopause and how it affects depression. Today's episode is brought to you by Headspace. You know when someone asks, how are you doing? And you automatically say, I'm fine. I've said that a million times, even when I'm not fine. But lately I've been trying to actually mean it when I say those words. That's why I've been using Headspace. Headspace helps me take care of my mental health in small, doable ways, like guided meditations, breathing exercises, sleep support, and mindfulness practices that fit into my real life. It's not about pretending everything's perfect. It's about giving yourself a few moments each day to slow down, breathe, and check in. And honestly, those moments have made such a difference in how I handle stress, how I sleep, and even how I show up for other people. Feel good and mean it when you say it. For a limited time, get Headspace free for 60 days. Go to headspace.com/askkatie. That's HEADSPACE.com/askkatie to unlock all of Headspace free for 60 days. Headspace.com/askkatie. Today's episode is brought to you by Fabletics. You know when you basically live in activewear, workouts, errands, lounging, and you realize your favorite pieces are the ones that make you feel put together and comfortable? That's been me lately, and honestly, Fabletics has become my go-to. When I signed up as a Fabletics VIP, I got 80% off everything, which is wild. And after that, the membership's about $60 a month unless I decide to skip. That monthly fee gives me a member credit that I can use toward a full outfit or bundle worth up to $100. Every month they email me and I decide if I want to shop or skip. It's super easy. The quality genuinely surprised me. I've been wearing their no-roll waistband leggings and soft joggers. I'm actually wearing those right now. And they feel like the premium brands that charge $200 for one piece, but at a fraction of the price. They stay in place, they keep their shape, and they're perfect for everything from filming days to travel. Plus, Fabletics is carbon neutral and uses recycled fabrics for about half of their pieces, which makes me feel good about supporting them. Treat yourself to gear that looks good, feels good, and doesn't break the bank with Fabletics. Go to fabletics.com/Katie and sign up as a VIP and get 80% off everything. That's fabletics.com/Katie to sign up as a VIP and get 80% off everything. That's fabletics.com/Katie. Moving on to question number 3, says, hello, howdy do. I'm curious about your thoughts about menopause and how it affects depression. Okay, we have 2 back-to-back menopause questions. I found this fascinating. So I have to pull up my research and note that this was minimal research, meaning I just opened some Johns Hopkins medicine articles. It's called Can Menopause Cause Depression? Okay. Now, the short answer is, shockingly or not, depending on if you have been following perimenopause or menopause content, yes, menopause can contribute to an increased risk of depression. It does not cause it per se, but it can contribute. And there are a ton of different factors or reasons for this. The first is what's kind of obvious is the hormonal changes that come along with menopause. So during menopause, if you don't know, our estrogen levels fluctuate significantly. And these fluctuations can affect the production of certain neurotransmitters such as serotonin and dopamine, which, if you didn't know, play a role in mood regulation. Therefore, if these things are going up and down, then we could feel depressed, and then maybe not, and then maybe more depressed, and who knows, right? We could feel like we're all over the place. I've heard from a lot of my friends who are going through this that they feel kind of crazy, that they'll wake up feeling one kind of way, and like an hour later, they feel totally different. That's because our estrogen levels are fluctuating a lot. There's also a lot of physical symptoms of menopause that can, I think, exacerbate depression. Things like hot flashes, night sweats, insomnia can make us more stressed and tired, obviously, right? If we're not sleeping well, if we're sweating and waking up a zillion times. Everybody's been joking about we wake up at 3 or 4 in the morning. That's like people going through perimenopause or menopause do. That's going to affect our sleep. It means we're not getting, a full 7 or 8 hours of good sleep. We're waking up in the middle of the night, and then we're hot and we're sweating and we can't go back to sleep. They also mentioned that there's life changes that often happen when we're going through menopause because of the age, that we could have, aging parents going through career transitions. We could have our children living at home, and they didn't, in the article, they just said they didn't want to forget about these things because these can also trigger or exacerbate already existing depressive symptoms. So in short, yes, menopause and depression can be connected. One does not cause the other. However, I think menopause can definitely exacerbate our already existing symptoms of depression. And per the article and other kind of treatment research articles that I read, one was in the National Institute of Health, the NIH. They recommend hormone therapy, obviously, for estrogen replacement. It's, HRT, they call it, hormone replacement therapy. So it can stabilize your hormones so they're not fluctuating so greatly, so you don't feel so erratic, and so not like yourself. A lot of my friends said they just don't feel like themselves. And then there's also antidepressant medication, therapy, the things that we always already talk about. But I found that really interesting. And if you are out there and you're looking for more information on perimenopause and menopause, Dr. Marie Claire, MarieClaire, I believe, is her name on Instagram. She is a obstetrician. She's a doctor anyway, medical doctor, and her specialty is in menopause. And she talks about all things menopause. She's the reason that I actually started, this is a total tangent, but she's the reason I actually started taking creatine. Her and Dr. What's her name? Rhonda Patrick is doing research on this as well. But she talks about the importance of creatine in a woman's brain as we age. And I have to be honest, this might be a video that I just riff on. I don't know if you guys are interested in this. Let me know. But as we age, we can have more brain fog, and it's harder for us to remember things. And I certainly have felt that way. And I attributed it to being burnt out, but no matter how much I took off of my plate or how much I tried to take care of myself, it didn't feel any better. In fact, sometimes it just felt worse, just depending on the day. And when I heard about this, I was like, oh my God, okay, I'm going to start taking it. Well, I was taking 5 milligrams a day, and Rhonda Patrick, then I went down this rabbit hole. Dr. Rhonda Patrick does research specifically on this, anti-aging and making our brains work better for us. She said that we need to take 10 or 15 milligrams. So I started doubling my dose. And you guys, when I tell you, it was like a light switch was turned on. I don't know if you had noticed, maybe you had, but prior to this has only been like the last, like, let's say 6 months or less. I've been doing this, but I would like lose my train of thought and I just wasn't as focused. And I felt so bad because I was trying so hard. It was almost like inside my brain, I was like really trying to focus. I just couldn't. It wasn't there. And then I was like, what's happening to me? Like, can I do my job? This is terrible. And like kind of having a crash out or a meltdown. But this has made all the difference. I'm like, old me. It's so crazy. So anyways, just throwing that out there as do your own research. I'm not a doctor. That's just my N of one in my study. You can read the research articles that Dr. Rhonda Patrick does. She's fascinating. She was also on Diary of a CEO if you want to listen to that one. If you don't really like reading, if you'd rather listen, and you can learn all about that. Okay, but moving on to our next question about menopause. Question number 4 says, Katie, is it true that menopause hinders ADHD meds from working? I barely function with them working. Another fascinating thing to research, and I truly could not find a ton of articles about this, which was kind of surprising. But they did say that even in WebMD, but that wasn't what I'd read. I'm trying to pull up. Oh, it was an NHS article, ADHD and menopause in the NHS. Essentially, if you're already on an ADHD medication, they might change the one that you're on or potentially your dosage because, and this is just wild to me, you guys, menopause can hinder ADHD medications by causing hormonal fluctuations that affect their efficacy, potentially leading to worsened ADHD symptoms. And the reason is because estrogen plays a crucial role in supporting neurotransmitters like dopamine, which are critical for attention and memory. If you haven't watched my older videos about ADHD, I even have a more recent one, ADHD in Women. Just look it up, ADHD in Women, Katie Morton. It'll come up. But I talk about how we often present a little bit differently and it can take us longer to get diagnosed. And I've heard from a lot of you are being diagnosed later in life when you also are going through menopause. And so it's really important for us to know that dopamine, the thing about ADHD brain is that we have the dopamine, we just don't have the transporters, meaning this protein that brings the dopamine into the reward center and parts of the brain where we really need the dopamine so we feel good. We don't always have enough of that. And so it can feel like the things that, I don't know, those of us without ADHD are able to like push through and do it anyways. Those of us with ADHD are like, this is not enjoyable at all. I actually hate it. It's terrible and I'm not interested. And so it can be really, really hard for us to focus, for us to complete a task, and especially for us to start a task. It's just really difficult because it's not rewarding and we don't like it. And so I didn't realize, and this is just, I'm learning something too, so thank you for your question, that estrogen plays a crucial role in supporting neurotransmitters like dopamine. And estrogen levels decline during perimenopause and menopause, and ADHD, as a result, ADHD symptoms can intensify, making existing medications less effective. So a couple of the recommendations were that hormone replacement therapy, getting on an estrogen patch or cream or whatever the doctor recommends, because that will, make it so that your ADHD medication still works the same as it did. Or another option was to increase the dosage of your ADHD medication. So whether that's like, I don't know, Vyvanse or Ritalin or whatever you're on, your doctor could increase that dosage. And if we want to get kind of nerdy about it, because I found this really interesting, about like why hormonal changes affect ADHD medication. So the estrogen is vital for brain health, and it helps our brain repair tissue and supporting the actions of dopamine and acetylcholine. Fascinating. Also, when we have hormonal changes, the dopamine regulation kind of goes up and down because our estrogen is going up and down. And so by promoting dopamine production and use, estrogen helps to improve focus, memory, and executive functions that are often impacted in ADHD. And when we're going through perimenopause and menopause, we have lower levels. Therefore, it can't promote dopamine production and use. And so it makes that harder. I think that's why we start to get brain fog and it's hard for us to focus even if we don't have ADHD. That's why creatine was like a game changer for me. Again, not a doctor, but ask your doctor. And then also, because the estrogen levels decrease so much, our brain has less support for a lot of these critical neurotransmitter systems, and systems can kind of go offline. And that means that everything, from focus to memory to organizational skills can be even harder. And so Anyway, I found that super fascinating. But talk to your doctor, because between the hormone replacement therapy and the increase of your dosage of ADHD medication, we should be able to mitigate it. I know you said you barely function with them working. Talk to your doctor, because I was shocked. Why aren't more people talking about this? It's not my specialty. I'm not a doctor, but I would love to have somebody on the podcast. Maybe I'll try to reach out to Dr. Marie Claire's people, or somebody, maybe Dr. Rhonda Patrick, to talk about this, because it's really important. A lot of us are going through it, and we need to, share in that knowledge. Okay. Let's move on to question number 5. It says, Kati, what are some things I can do to improve my communication skills with my partner? I love this question. Communication in relationships is make it or break it. If we can't communicate, relationships fall apart. I recently had a close friend of mine who is just a poor communicator, and she wanted her partner to move with her and do this. She was transitioning in life, and she wanted to move to this new house, and she really wanted him to come with her, but she didn't communicate it very clearly, and he did not feel welcome, and they almost broke up. They finally figured it out, but her communication skills were so poor that the relationship almost ended. And so I just want you to know that you're not alone, that a lot of us don't communicate well. Our parents didn't teach us. Most of our parents still don't know how to communicate effectively, right? And so a couple of tips for communication improvement. Also, I believe, I'm pulling in my memory here, but I believe I have a whole workshop on communication at katiemorton.com. You can go check it out in the shop. I think we've lowered the price of all the workshops, are like $24 or something. Hopefully that's in your budget. But there's a ton of communication skills I offer there. I'm going to give you 2 today, okay? Now, first of all, my first communication skill that I think is helpful for everybody is when we need to ask somebody for something, or we need to set a boundary. So it's called Dear Man, and it's from DBT. And if you're not familiar, the DEAR stands for describe, express, assert, reinforce, DEAR, sorry. The M, what am I forgetting? The A is appear confident, and the N is negotiate. I'm forgetting let me look it up really quick here. The M is in, mindful, stay mindful of your goal. Okay, sorry. But essentially, we use Dear Man as a way to assert ourselves, to request things, to set boundaries, to ensure that our needs are clearly communicated while also respecting someone else. Now, here's the way it works. You write Dear Man, this acronym, DEARMAN, down the side, and in the D column for describe, state the facts of the situation objectively. This is not a time for emotions. This is not a time for opinions. This is just what's happening. Then the E is express. So you want to clearly share your feelings, usually using I statements. Like, I feel that, when you say something like that, I feel very hurt, or I get very upset when I don't feel listened to. And that's what I'm interpreting this as, right? You can express that. Then A is assert. And so you have to make your request, state what you need or asking for, or maybe say no, like I can't do that. Then the R is to reinforce. So you explain the benefits of getting that need met. So let's say it's you telling them that you need them to help you. I don't know. Let's say you're moving and you need them to help you, and you live in the same house together, and you're like, I know you've already packed up your own stuff, but if you help me with the kitchen, this will all go much smoother. And then we'll be able to have Sunday off completely and do nothing. Right? So we reinforce. What do you get out of it? Or the reinforcement could be, and then I'm happy. And so you're happy. Mindful is the M, and it's essentially like staying focused on your goal. Don't get distracted. Don't go down rabbit holes. Don't get pulled into another thought spiral or thing, and don't let them pull you in. A is appear confident. Make eye contact, shoulders back, sit up straight, look them in the eye. It didn't say you have to feel confident. It said you had to appear confident, right? And have a self-assured tone of voice. Don't look down and mumble to yourself. I want you to speak clearly and directly, like you know what you're wanting. And then negotiate. That's really being willing to compromise. Not everyone's going to think about things the same way. Not everyone's going to like exactly what you like or want to do the things you. So if they're like, well, I don't really want to help pack up the kitchen, you can be like, well, can you help me just with the dishes, with just the plates and the bowls, or something. That's a negotiation tactic. And you can use that. And I love Dear Man because sometimes when we have something that we need from someone else and we don't communicate it, then that can build resentment. because it's like we're not giving them an opportunity to meet us where we're at, and then we're upset when they don't. And this is just a nice way to ensure that that doesn't happen. That makes sure that we're speaking up for what we need. Now, you'll do Dear Man this way. I encourage you to write it down and write it out and kind of practice it yourself for a bit and then present it to your partner. But as you've done it more and more and more, it'll get quicker and easier, and you can kind of almost do it naturally in a way, because it is really clear communication. That's what that helps you do. And that helps you ask for what you need, or, assert yourself or say no, etc. Okay. So that's my first communication skill. The second is to listen to learn. Now, I know that this is hard for people. When we feel triggered, when we're emotionally overwhelmed, we can really want to listen to win, right? Or listen to fix. I'm guilty of listening to fix. We can listen to someone not because we actually want them to tell us what's going on or for us to learn about their experience. Instead, we listen for holes in their story, things that we can pull out, because if we're in an argument, we want to win that argument, and we can fight with them that way. So we listen to win the argument. So we're not really listening. And if we're listening to fix, it's the same. We're looking for things that we know how to do better, and then we're going to tell them. Neither of those improve communication or help people feel heard and understood. So we need to listen to learn. When someone's telling you about their experience and how they feel, I need us all to be able to take a deep breath, know that we can still be upset, but that doesn't mean we have to react. We don't have to lash out. We can hear them out. We can ask follow-up questions. Oh, I didn't know that hurt your feelings. Can you tell me more about that? Or, I didn't realize that was so triggering. Do you know where that comes from, or when this happened? I didn't know. We can listen to learn about them, and that will drastically change your relationships. I'm actually going to throw in a third, because this one has been really helpful for me, is that if you can identify some of your own communication blunders, like I'll speak personally, mine is to be passive aggressive and to do the silent treatment. Those are two things that I used to do a lot. And I'm saying used to because I've been working on it. So I used to just be flustered and like walk away and be like, meh, meh. My silence will speak volumes, and then I'll act passive. Are you fine? How are you doing? Fine. Like, I'm not good, but I'm not going to tell you, right? That's how I used to act all the time, if I'm being honest. It's not good, but I did it. So my therapist encouraged me to do the opposite, to lean in, to tell them what I'm actually thinking and feeling. I know, terrifying, but a little opposite action. When you know your blunders, you have to spend a little time and figure out, like, what am I doing? I actually talk about these in my new book, Why Do I Keep Doing This? You can pre-order now. It comes out December 9th, link in the description. Gentle plug. But we have to learn what our communication blunders are so that we can act in a different way, right? Because we want to improve our relationships. I want to be able to communicate. I don't want to be passive aggressive or use a silent treatment anymore. And so once I realized that's what I was doing, I did the opposite thing. When I wanted to be silent, I tried to talk more. When I wanted to be passive aggressive, I tried to be direct and say, like, hey, that hurt my feelings. I didn't really like how you said that. Was it scary? You betcha. Did I fuck it up a few times at first? Of course. But it got way easier little by little as I pushed myself to try and lean in instead of pull back, because I'm definitely more of a like retract kind of person. Yeah. The fact you're even asking proves to me that you are a great partner. So I hope that some of those tips and tools helps you be even better. Moving on to question number 6. It says, hey, Katie, I hope you're well. I am. I hope you're well. I was wondering why I feel such an identity shift with a change in diagnosis and what to do about it. Today's episode is sponsored by Crowd Health. It's that time of year again, open enrollment. And honestly, every year it feels like the same confusing maze of options, fine print and rising prices. You scroll through plan after plan and somehow end up paying more for coverage that barely makes sense. That's why I was so intrigued when I learned about Crowd Health. It's not insurance. It's a completely different way to handle healthcare. For under $100 a month, you get access to a team that helps you negotiate medical bills, find affordable prescriptions and lab tests, and connect with trusted, high-quality doctors. And if something major happens, you pay the first $500, then the crowd, a community of members helping each other, steps in to fund the rest. Pretty cool. It's simple, transparent, and honestly feels empowering. Instead of getting lost in the health insurance game, you're taking back control of your healthcare and saving money while you do it. So this open enrollment season, take your power back. Join Crowd Health and get started today for just $99 for your first 3 months using code AskKatie at joincrowdhealth.com. That's joincrowdhealth.com, code AskKatie. Crowd Health isn't insurance. Opt out. Take your power back. This is how we win. Join crowdhealth.com. Today's episode is sponsored by OneSkin. You know that feeling when your skin starts to change? Maybe it's looking a little dull, less firm, or not bouncing back the way that it used to. And you can start to wonder if anything out there actually works. I've been there, and that's why I was so curious to try OneSkin. OneSkin takes a science-first approach to skin aging. Their products like OS1 Face, OS1 Body, and OS1 Eye are built around their patented OS1 peptide. It's the first ingredient proven to target the root cause of skin aging, senescent cells, helping improve firmness, smoothness, and elasticity over time. I've been using the OS1 body and face creams, and honestly, my skin just feels healthier, softer, more hydrated, and it looks more even. It's easy to use too. Cleanse, pat dry, apply twice a day, and that's it. Born from over 10 years of longevity research, OneSkin's OS1 peptide is proven to target the cells that cause the visible signs of aging, helping you unlock your healthiest skin and hair now and as you age. For a limited time, try OneSkin with 15% off using code Katie at oneskin.co. That's 15% off oneskin.co with code Katie. After you purchase, they'll ask you where you heard about them, and please support our show and tell them we sent you. Moving on to question number 6. It says, "Hey Katie, I hope you're well." I am. I hope you're well. I was wondering why I feel such an identity shift with a change in diagnosis and what to do about it. In the last 5 years, I've been diagnosed with ADHD and ASD. Recently, I went to a new psychiatrist to renew my eating disorder plan when she decided to also comment on my other diagnoses. She said she isn't convinced that I have ADHD or ASD. ASD is autism spectrum disorder, by the way, because apparently I don't have trouble making friends. That's not the only thing. Okay, it's not the only symptom. She believes instead that I have OCPD. Wow. Okay. OCPD stands for obsessive compulsive personality disorder. And that differs from OCD in the fact that OCD is ego dystonic. Like we don't like our compulsions. We don't like the obsessions. It's very uncomfortable. We hate it a lot. OCPD is ego syntonic. It feels good. We actually prefer to do things our way, and we like to have things just so, and it feels good. So that's really the difference there. Okay, back to the question. Sorry. I spoke to my therapist who I've known for years, and she doesn't agree. She believes I do have ADHD and ASD. I feel so confused. I don't know who to believe. Perhaps it was my fault for making my diagnosis part of my identity. That's what I'm going to get into. But I don't know what to do now. Do I trust my psychiatrist who met me once and spoke to me for an hour, or do I trust my past psychiatrists and my therapist who knows me well? And there was an add-on that says, I'd like to know in general how to think of or what to do with diagnosis labels versus actual symptoms. It matters for insurance. It might matter to a psychopharmacologist, like do you need stimulants or mood stabilizers for that same symptom? In terms of feeling it, talking to a therapist about it, and getting support from people online with similar issues, does it matter at all? Okay, a lot to unpack here. And first of all, I just have to say that the person or people who are on your treatment team who see you the most are going to be the best at giving you a proper diagnosis. There, I've said it. You might see a psychiatrist for an hour? You said this person they've seen you once and don't agree with your diagnoses? Come again? How much time have they spent with you? They can disagree. I'm not saying that they can't disagree. However, your therapist and your past psychiatrists have seen you for years. And not to like discredit psychiatrists, because that's not the plan here. But as a therapist, I have to be honest that we get talked down to a lot by medical professionals like psychiatrists and other doctors, that they know better. But we arguably spend way more time with our patients. Now, I'm not saying that they can't see something that I've missed or that I'm infallible. I'm just saying that I truly believe that the more time you spend with a patient, the better opportunity you're going to have to give a proper diagnosis, because you're going to see them like over a year or more. and the ups and downs. And I can't tell you how many patients I've had of mine who I thought maybe had bipolar disorder, but over spending time with them and seeing what I thought was their quote unquote mania, I realized it was actually borderline personality disorder. And that was dysregulation, because it would happen way more quickly than my bipolar patients. But if I didn't see them regularly and get to also notice, issues in their relationships and some patterns there, I might not have given them a proper diagnosis. And I always take my time, especially giving personality disorder diagnoses, because I feel like those are more pervasive. It means that it affects more parts of your life. And so I'm going to have to get to know you and your patterns and your life in order to do that properly and to check all those boxes. And so I don't know you and I don't know your situation other than what you've told me. However, this one psychiatrist who met you once and wants to say that your diagnoses are not correct, I don't necessarily agree with that at all. I would talk to your therapist about it. Tell them, hey, they said this to me and it kind of threw me for a loop. Can we talk this out? Because any therapist would be like, yeah, I've never thought about OCPD. I mean, I can even see myself right now, like making a note like OCPD ? And then pulling out the DSM and talking you through the symptoms to see if you and I think it aligns. And then we can track it and see if we agree or disagree. I'm never opposed to changing a diagnosis for a patient, but to have someone kind of swoop in who hasn't been seeing you at all, see you once and be like, I don't agree with this, feels a little aggressive to me, but some psychiatrists are like that. And so hopefully as a treatment team, you can work together, meaning your psychiatrist, talk to your therapist. I know they don't always get back to us and we leave messages and stuff, but hopefully they can figure it out for you. Because yes, it might be not the correct diagnosis, or it may be OCPD is what it is, but we need to take our time with it. This isn't something we can just swing in and be like, yep, this is what it is. I find that to be the most upsetting piece of this, is for them to say that to you, not to talk to your therapist, but to throw out a diagnosis like that when they've only met you once. I don't operate like that. And I don't really like people who operate like that. Now, the final component of this is about having your diagnosis be part of your identity. Now, I know that, and even by the way you wrote it, I know that you're like, I shouldn't have made it my identity. No. And I kind of blame social media for that, because we can want to get support and not feel like alone with our new diagnosis, or we want to seek more understanding or have people who are going through it too, and we can gain some insights. But sometimes in that process, when we do that, we are part of all these different like support groups on Facebook or other social media platforms, we can start to feel like that's who we are. And then we can put it as part of our bio. Like if you go to someone's profile and it's like ADHD queen, ASD, like, no. And I'm not saying that there's anything wrong with owning up to the fact that, oh, this is my diagnosis and this is, what's bothering me, or this is what I'm working on, right? Like my depression doesn't define me. Your ADHD or ASD isn't all that you're about. Yes, that means your brain might work differently, and maybe you have to do certain things in order to remember to take your keys on the way out of the house, or you have like certain tools and tricks you use to make things better for you. But everybody kind of does that. We will try to work with ourselves, not against ourselves, right? And so obviously I know you already know this, but that's why I've always thought that we should never make our diagnosis who we are. It should be a part of us. Just like I would say I'm a therapist and I'm a content creator. Those are two different things, but they go together, right? And they're just part of me. They're not all of me. I also have a lot of other things that I like to do and a lot of other pieces that make me me. And the same goes for you. And so if you find yourself making your diagnosis or diagnoses your full identity, I really want to encourage you to start kind of separating them in language. That's usually the first thing I do with my patients, is talking about, you can give it a name. Like with eating disorders, we do this all the time. It's called externalization, but it's like you give your eating disorder a name. I don't know, like a lot of people call it ED because ED, eating disorders, but some people call it like Ned or a Karen, or they'll give it some kind of name like, I don't like this, or like one of my patients had this bad relationship with a certain person, so they called it that name. You can call it whatever you want, but I encourage you to give it to other it, to give it an external kind of name. So when you talk about ADHD, don't be like, I'm ADHD. You see, like my ADHD does X, Y, and Z. And sometimes it drives me crazy. And then I forget about, or my ASD makes me think this way. And it's so frustrating. I want you to talk about it like it's outside of you, not part of you. And I know you might be like, but Katie, don't I need to accept my diagnosis? That's not the same thing. Accepting a diagnosis means that we understand it and we agree with it. And it's part of what we're going to figure out really like how to manage, right? And that could mean that we manage it through medication or different tools and techniques and with our treatment team. And that's fine. That's part of the acceptance. But we can still externalize it so it doesn't feel like that's all we're about. No one's only about their diagnosis, or we shouldn't be. There's so much more to you. There's so many more interesting things that make you who you are. And so we really want to separate. And that externalization can be a great way to start doing that. Now, that add-on that I read, they wanted to know in general how to think of or what to do with diagnosis labels versus actual symptoms. Yes, the labels do matter for insurance, like having a proper diagnosis and getting assessed is going to be important if you're expecting treatment to get covered. And it matters for medication, like they mentioned, like a psychopharmacologist is going to know what you need, but they're wondering like in terms of feeling it and talking to a therapist about it and getting support online. Now, I really do encourage all of you, if you think that you have a certain diagnosis, go see someone and see if that is the truth. I'm not saying that you don't know your experience best, but I really do think it's important to get a proper diagnosis because we could assume we have something and go down an entire rabbit hole only to find out it's something completely different. Because the great thing about seeing a professional is that with my expertise and your experience, remember my old saying, we work together towards a healthy mind and a healthy body. And I still firmly believe that like it's like our powers combined, like Captain Planet. We can do better together. And making assumptions and going down rabbit holes and saying you have something when you haven't been properly diagnosed. I mean, I guess it's fine, but I feel like in a lot of ways, then we start internalizing this diagnosis. We can start thinking that that's who we are and that's what we're about. I want you to externalize this, first of all, but second of all, I really want you to get properly diagnosed because that means that then we are sure that this is what's going on and we can get tools and tips and techniques and possibly medication to make it better. But self-diagnosis, I think in many ways can help us feel better, help us feel validated or heard and understood, but nothing's going to do that as much as a proper diagnosis from a professional. So I'd really encourage you to do that. Okay. Moving on to question number 7. This question says, Katie, would you please cover women being diagnosed with ADHD later in life, like ages 55 plus? This happened to me, and I was misdiagnosed with bipolar disorder about 20 years ago. My psychiatrist is slowly tapering me off of bipolar meds. I'm recently completely off of the antipsychotic. That's wonderful. I've been taking them since the wrong diagnosis. Wow. Now I'm taking a stimulant for ADHD, which is so far helping a lot. Isn't that amazing? That's why it's important to get properly diagnosed. I know you tried to and they misdiagnosed you. We'll talk about this. I am worried about possible permanent damage to my brain and body after wrongly taking an antipsychotic and mood stabilizer for 20 years ever since my bipolar diagnosis. Okay. Let's address that part head on. I don't know of any permanent damage to your brain and body for wrongly taking an antipsychotic or mood stabilizer. Because once you stop taking it, yes, there's a half-life of the medication, but it'll slowly work its way out of your system. The only thing I would ever be concerned with is if you had a potential side effect. Like with antipsychotics, some people get like tardive dyskinesia, or there's other gynecomastia where men can grow breast tissue. Depending on the antipsychotic or different medicine that you're on, it can have different side effects. And so if you have a side effect like that, some of them will go away when you stop taking the medication, like the gynecomastia, the sexual side effects. If you have nausea, headaches, all that stuff goes away when you stop taking the medicine. But things like tardive dyskinesia are not reversible. It doesn't go away. There are medications to manage it. So I guess I'd talk to your doctor and see if, but you'd know if you have any side effects that would like not go away. I feel like you'd already be experiencing them. And the fact that you're going off of them with the help of your psychiatrist is really important. Do not stop your medication without talking to your doctor. Don't do that. There's withdrawal. There can be all sorts of issues. We need to be careful. So I'm glad you're doing that. So I don't know of anything like that. Again, I'm not a doctor, but I did have to take a pharmacology class in school to make sure that I was aware of these things. And I've worked with patients and psychiatrists over the years. I wouldn't, not to say like, don't worry about it, like so flippantly, but there is no knowledge that I have other than what I just stated, like certain side effects that don't go away and are not, we can't like undo the damage. I don't know anything about that. I've never heard of that happening. Okay. Maybe there's weight gain and that could take us time to lose the weight, but it's not going to hang around after we stop the medication. Okay. Now, back to your original piece of your question, like being diagnosed later in life and misdiagnosis. So being diagnosed later in life, I find in general, and people might have feelings and thoughts about this, but women in general tend to be misdiagnosed. I forget the percentage. I read an article. I think it was PubMed. I can't remember. But anyway, I read this article about women being misdiagnosed versus men, and the women, it's so much greater. I think a lot of it has to do with our bodies just being different. And a lot of studies and a lot of criteria were created based on men. And so because we're different, we end up being misdiagnosed more easily. I've had tons of patients who are misdiagnosed with bipolar disorder and they really have BPD or vice versa, ADHD also. I'm glad that this is finally, like you're finally getting properly diagnosed and the medication's working. I guess in general, I have a video about ADHD in women that you can watch and why it's so often overlooked. We often present differently. Like I'm just saying, we're different. Our bodies are different. Our hormone makeup, our chemical makeup as a human is so different that ADHD presents in ways that we often don't think of. And so we can be like high functioning, like white knuckling school. Like one of my close friends I think I shared in the video, one of my closest friends just got diagnosed with ADHD and she's turning 40 this year. She was diagnosed 2 years ago and she was like, oh my God, this would have made me feel so much better in school. Cause she always thought she was dumb. Like school was so hard for her. And I hate that happened. In general, if you're getting a new diagnosis, I guess this is kind of my advice in general, is if you're getting a new diagnosis, there's nothing wrong with seeing a different doctor and getting another opinion. Is that a pain in the ass? You betcha. But would it be worth that little bit of the pain in the ass to make sure that the medication and treatment you're getting is good? Or making sure that you don't maybe just see, and I'm not downplaying like therapists or psychiatrists, but maybe we actually go take an assessment. Most insurances cover them. And if not, often they're not that expensive. It depends on where, but UCLA used to offer autism diagnosis, ADHD. There was another one I'm forgetting. I think it was like oppositional defiant disorder. Anyway, they had a lot of assessments there and I sent a patient and it was like $200. And yes, that might be a lot, but we could save up and we could do that just to make sure that we're properly diagnosed. And some things, I remember one testing and assessment, somebody said they spent like $1,200. So ask questions before you sign up, make sure that you can afford it and all that stuff. But I really think getting a proper diagnosis is going to be key. And, it's what we all want. And I think just being diagnosed later in life will probably, not to make assumptions for you, but I think when this happens, we often look back at our life it's almost like with the different colored glasses on. And we look back at that timeline and we're like, oh my God, that's why and it all starts to kind of make sense. And it all starts to fit into place. And we're like, that's why that was so hard for me. Or that's why I always felt like I was lazy and couldn't get started. I had ADHD. Fuck. Like it gives us a whole different perspective and we're looking through a completely different lens now. And so I encourage you to maybe take some time and do that kind of internal detective work where you look back, and sometimes it can be really validating and it can make us feel better now moving forward. There can be some grief there. I encourage you to take your time with it. But you said you're seeing a psychiatrist. I would hope you're seeing a therapist. And if not, this might be a good time to add that in as well. Okay. And I have my video about women with ADHD that maybe that would be helpful for you as well. Thank you all so much for sending in your questions. Thank you for sharing this podcast. Thank you for giving it reviews. Thank you for pre-ordering my book, Why Do I Keep Doing This? Have a wonderful week. Do your homework, and I'll see you next time.